We really don't have much time. I mean, when somebody looks at you and says, you know, we'll get these things done by and by, people are dying by the hour. 22 to 30 Americans die every single hour on average. 22 to 30. I stick with the figure 22. My friend Dr. Chuck Denham, who has also been tremendously effective in patient safety, says it's 30. Whether it's 22 or 30 is not important, but that's half of them for nosocomial infections and half of them for medical mistakes. Gosh, we got a lot of bad doctors in hospitals, right? No, you see, we don't. We have something that grew like topsy over time. It has grown organically. We do not have an industry full of bad people. We have an industry full of good people who have never come together in a system. George Halverson, head of Kaiser Permanente. I know we got some Kaiser folks in the audience here, and I've had wonderful times among you, especially in the Southern Division in the last couple of years. George said, rather famously a couple of years ago in a book called Healthcare Reform Now, he said, we do not have a healthcare system in the United States. And people went, we don't. Matter of fact, most of them rejected that. But he's absolutely right. We do not have a healthcare system. This is the charge. You see, you remember that line from Dickens, the very first opening line from Tale of Two Cities? It was the best of times, it was the worst of times. I watched Jon Stewart making fun of that line recently. Cartoonists have had fun with it. Even Geico got into the act with it. But in many respects, that's where we are. It's the worst of times if you take a look at the tsunami coming at us. 17.5%, almost 18% of our GNP, headed to 20% right now for less than 50% of the quality of the rest of the world. The figures that I just mentioned to you, the people that we're killing. This doesn't even talk about the people that we're maiming, hurting for life. We are, though, at the best of times in this regard. We got a white slate in front of us. And you all are right at the forefront, supporting this organization, moving it along. It is now time that Don has stepped down, and Don Berwick's been a friend of mine. I've been very honored to know him, too, for a long time. Kathleen and I both sat in his office just like last January, knowing that his tenure would be short, but he has irrevocably changed things. But one of the things he's changed is the fact that we have to be engaged as a society with where this non-system is going and how to make it into a system. And primary element among all others is that we can't do any harm. We can't hurt anybody. We can't kill anybody if we're going to do it right. Everything else that might come in terms of whatever form this system takes when it becomes a system, that has to be a bedrock basic. So I want to take you through a couple of paradigms today in terms of why we're where we are and where we need to go.